So my dear students, I hope you all have been doing well. I'm Dr. Qurat-ul-Ain, and from today we are starting our course of pharmacology, and this is my lecture number 1. And in this course, we would be studying all about the drugs. How the drug is metabolizing, how the drug is producing its mechanism of action, how the drug is eliminating from our body, and many other things. So I divided this course into different lectures, and they may be 20 to 25 lectures. And this is my first lectures in that we are specifically going to study about the basic definition of pharmacology, and then what is the drug, what is the dosage form, and what type of the dosage form the drug is available, and finally we would be studying that what are the branches of pharmacology. So before going to the depth in this lecture, we first have to understand that actually what is a pharmacology. So actually pharmacology is a Greek word, and it composed by the two words. One is pharmakon and the other is the logos. So pharmakon means drug in English, and the logos means the study. So when we compose these two words together, so it means that study of a drug. So what question is this, that what we study about a drug in the under the field of pharmacology. So actually pharmacology is a branch of science in that we study all aspects of a drug: how the drug introduced in the body, how the drug eliminating from the body, how the drug producing its effects, and how the drug is producing its adverse effect, and what are the mechanism of action of a drug, and how the drug is metabolizing, how the drug is distributing throughout our body. So now the question is this: what is a drug? Because pharmacology is a science that deals with all aspects of a drug, what drug is doing when enter in the body. So now here the basic question is this: what is a drug? Because first we have to understand about what is a drug, then we would be understanding that how the drug is producing its effect, how the drug is metabolizing, how the drug is eliminating from the body. So when we say the word the drug, so drug means any chemical substance that is either extracted from the plant or synthesized in the laboratory by synthetic process, and that chemical that chemical could be able to bring a change in the physiology of an organism. So what is a drug? Actually, drug is any chemical, either natural product or extracted from natural source, from the plant and from any other natural source, from the means marine organisms, from many other there are many natural source. From that we can extract some chemicals that can bring a change in a physiology of an organism. So what is a drug? Actually drug is any chemical. They could be synthetic, they could be natural. If this chemical bring a change in the physiology of an organism, so we call this chemical is as a drug. Now the other question is this: in what forms of a drug can be available, or in what form we can take a drug? So we can take a drug either in the liquid form or in the solid form, or via the different routes. So all the drugs that available in the liquid and solid form that we can take via oral route are called as liquid dosage form, or the liquid or solid dosage form, or the oral preparation. However, all the drug that we administer in the body through the rectum, are called as rectal preparation. They may be suppository or they may be enemas according to the site of route of administration. Either we are going to inject in the vagina or the rectum. And the other dosage form is the parenteral preparation. This is a form of a drug, and this is a dosage form that we enter directly into the arteries or the vein. So mostly the drug that are enter in the body through arteries or vein, they are available as in the liquid form that are present in the ampoules or the vials. So the other form other dosage form is the inhalation preparation. All the drugs that are intended to be inhaled. These are inhalation preparation. They may be gases, volatile liquid, and so on. And the other preparation of other dosage form is the topical preparation. So all those drugs that intended to be prepared to apply over the skin are the tropical preparation. They may be ointment, they may be creams, they may be lotions and liniments. Another preparation is another dosage form is the eye drops and the nasal drops that are actually the liquid form of a drug and directly and introduced in our eye or the nose. And another dosage form is the mouthwashes and gargles. Another is the powder that mostly we use powder over the skin. So So there is a book that is containing all the information about all the drugs that are clinically available. So what does mean by all the information? All the information means all the formulas of the drugs, how the drug is prepared, how the drug dosage form is prepared, all the adverse effect, all the adverse effect, all the mechanism of action, all the route of administration of a drug. So this pharmacopoeia is a book that is containing all the information that is relevant to the all clinically available drugs. So now we would be studying about the type of doses. So we have understand that what is the pharmacology. We have understand that what type of a dosage form are available and in what types drug can be introduced in the body. So now there is another term that is a doses. So what is a dose? Actually, dose is an amount of a drug in simple word. So there are different type of doses. One is the therapeutic dose. Actually, the therapeutic dose is that average amount of a drug that when we introduce in our body, produce a therapeutic effect. And the other term is the loading dose. Actually, the loading dose is the product of the therapeutic concentration or therapeutic amount of a drug multiplied by the volume of distribution. So what is the volume of distribution? Actually, the volume of distribution is that apparent volume, that volume of body fluid in that drug is going to be distributed. So and the loading dose is the product of the therapeutic concentration and the volume of distribution. The other term is the maintenance dose. The maintenance dose is that amount of a drug that maintain steady state concentration of a drug in our body. However, the maximal tolerance dose is that amount, the maximum amount or maximum dose of a drug that can be tolerated by a living being. And the fetal dose is that amount, that minimum amount of a drug that can be uh, the that amount of a drug. Fetal dose is that amount of a drug when introduced in our body produce so extensive adverse effect that could be lethal for a living being, that cause death for a living being. And now we would be studying about the branches of pharmacology. So we have already studied that what is the pharmacology. So and now pharmacology is a branch of science in that we study all aspects about the drug. So pharmacology is subdivided into many different branches, and each branch is specifically deal one aspect of a drug. So what is the pharmacognosy? Actually, pharmacognosy, in the pharmacognosy, that is a branch of pharmacology, we study all aspects of all those drugs that are extracted from natural source or from plant source. So all those plant products that capable to change human physiology, that capable to bring a change in the human physiology, and how they are bringing a change. All these aspects of uh, plant produce or natural product based drugs we study under the heading or under the branch of pharmacology, that is pharmacognosy. Another branch of pharmacology is a pharmacotherapeutics, in that we study about the prevention, diagnosis, and cure of a disease. And the other branch of pharmacology is a pharmacogenetics. And in this branch, we study that if the drug or a chemical substance that we call as a drug is affecting or is bringing any change in the genome of a living being. So this study we deals all these aspects, effect of a drug on the gene of a human being, we study under the pharmacogenetics. So another branch of pharmacology is a pharmacogenomics, in that we study if the drug is bringing a change in the inheritance pattern of a living being. And in the pharmacoepidemiology, we study the effect of a drug in certain population. And in pharmacoeconomics, we study how much the drug is cost effective. And in the branch of toxicology, this is also a branch of pharmacology, sub branch of pharmacology, we study the adverse or the side effect of a drug. Now we would be studying about different route of drug administration. So up till now, we have discussed about that what is pharmacology. We have discussed about the how in what forms drugs could be prepared, what that we say as dosage form. We have studied about that what type of doses, what are the type of doses, and what is a dose. And we also have studied that what is a drug, what is a pharmacopoeia, and what are the branches of pharmacology. So now in the final means few slides, we would be studying about that how and from what sides the drug can be introduced in the body. So the types, we call these all the sites as a type or the route of drug administration. So we can introduce the drug in our body via various different sites. So one is the antral. In antral, we can introduce the drug via our mouth. So when we administer a drug via our mouth, we say is a oral route of drug administration. So what happened when we uh, enter the drug via our mouth? It directly goes to the portal circulation and subject to the first pass metabolism. So here we have to understand that what is the first pass metabolism and what is the portal circulation, what is the systematic circulation, and how the drug is affected uh, by when we take the drug via different route. So first we clear all these ideas. So what is the portal circulation and what is the systematic circulation? First we would clear these ideas. So actually our circulatory system composed of two division. When we talk about the pharmacology of a drug, one is the portal circulation and one is the systematic circulation. So the portal circulation are all those veins and the arteries that surrounds the liver. um, they make up a system that we say as portal circulation. So what happened when the drug, when we inject via mouth, so these the drug directly goes to the portal circulation. From the portal circulation it enters into the liver, because the portal circulation are composed of all the veins and the arteries that are surrounding the liver. So when our drug is reaching to all those veins and the arteries that are surrounding to the liver, so the drug would go into the liver. So liver actually having different um, drug metabolizing enzyme that we say, like cytochrome P450. So what happened then when the drug would be reaching in the liver? So all the drug metabolizing enzyme that are present in the liver, that metabolize a drug, and the drug, after metabolizing by liver metabolizing enzyme, certain portion, not all the drug, certain portion of the drug would then enter in the systematic circulation, and then from the systematic circulation it would reaches to the target site. So this was the one division of the systematic circulation, and this is how the drug metabolized by liver metabolizing enzyme. However, other portion of the systematic or the circulate other portion of the circulatory system is the systematic circulation. So systematic circulation are actually all the veins and the arteries that are spanned throughout our body, except that all the veins and the arteries that are surrounding the liver. So what happened when we take the drug through our lingual route, sublingual route. So this drug directly enter to the systematic circulation. So the drug that are directly enter to the systematic circulation, it means they are not going to the portal circulation. If the drug is not going to the portal circulation, it means it is not entering into the liver, and it is not metabolizing by liver metabolizing enzyme. So when we take the drug via sublingual, so the 90% or almost more than 90% or the maximum amount of a drug reaches to the systematic circulation. So there is also a one term, that is the bioavailability. We would be understanding that what is a bioavailability in our coming slides. Up till now we have to keep in our mind that uh, there are two routes. One is the sublingual and other is oral. So when we take the drug via oral route, it reaches to the portal circulation. From the portal circulation, it is reaches to the liver and metabolizing by liver metabolizing enzyme. We call this process as a first pass effect. And the other route is a sublingual route. When we taking the drug under the tongue, so the drug is directly reaches to the systematic circulation and bypassing the first pass effect. Now, the other route is the rectal route, in that we directly introduce the drug in the rectum. So, introduce the drug in the body through the rectum. And this route is having some drawbacks. One is that when we introduce drug in the body through the rectum, it causes the irritation and pain to the administration site. And the other drawback is that we need a large amount of drug to be introduced in the rectum, to be injected, to be introduced in the body through the rectum. So now other route of drug administration are the parenteral route. Parenteral route are subdivided into many other routes. One is the intravenous route. In the intravenous route, we directly inject the drug in the vein. However, in the intramuscular route, we inject the drug in the muscular muscles. Intradermal route, in that we inject the drug in the dermis. And subcutaneous route, in that we inject the drug under the skin. And then intrathecal route, in that we inject the drug around the through the thecus in the cerebral CSF, cerebrospinal fluid. So when we take the drug through the parenteral route, so what happened? The drug is rapidly absorbed. Question is why? Because we are directly injecting the drug in the vein, in the systematic circulation. So that directly reaches to the site of action, bypassing the portal circulation. So that is why the drug that we taking via the parenteral route having rapidly absorbed, and it is having 100% bioavailability. So now question is this here, that what is the bioavailability? Actually, the bioavailability is the fraction of a drug that reaches to the systematic circulation or the target site without unchanged form. So when we take a drug in the through any route, that is taking the drug directly in the systematic circulation. So what happened? The drug would not go into the portal circulation, would not go into the liver, and would not metabolize by liver metabolizing enzyme. So in this case, the drug, the the highest amount or the total amount, maximum amount of a amount the drug reaches to the target site. So the 100 bioavailability of a drug would be 100%. However, all those the drug that we take through the sublingual route go to the systematic circulation and metabolized by liver enzyme, and very less portion of a drug reaches to the target site. So in this case, the drug would not be having the 100% bioavailability. So there are other type of route of drug and administration. One is the inhalation, in that we use we directly expose our lungs with the drug via the nose, and it produces a local effect. And certain another route of drug is administration is the topical route, in that we directly apply the drug over the skin or over the topical areas. So it may cause the irritation. So this was all about the basic of pharmacology. So in this lecture, I would also wish to conclude this lecture. Up till now in this lecture, this was my first lecture, and in this lecture, what we have studied about the basic definition of pharmacology, what is the pharmacology, and we studied about what is a drug, and we study about what the dosage form of a drug are available, and we study about what are the route of drug administration, at from what side drug can be introduced in the body. We have studied what type of sub branches of pharmacologies are existent. So my this lecture would also be available on request. PowerPoint presentation I can provide if someone wishes to have it. So you can just email me, and from the coming lecture we would be studying about the pharmacokinetics and pharmacodynamics. And I would say you thank you very much for your kind attention. Please keep waiting for my next lecture. Allah Hafiz.